Good morning, everyone. Happy to have you along here for today's tour of Coverage for One, where we'll be focusing specifically on how Coverage for One supports your Medicare supplement and prescription drug plan business. My name is Randy Lober, Learning and Development Specialist here at Action Benefits, and I'm pleased to lead the majority of today's conversation. Also joining me here today is Kevin from our individual team. He's an account manager, may even be your account manager. Kevin, want to give you a chance to say hi before we get started here today.
Hi, everyone. I'm Kevin from the Medicare and Individual team, and I hope everybody has a great day.
Thank you for joining us here today, Kevin. I'm sure the agents will love to hear some of your expertise as you have gathered it from talking to folks in the field here. And without any further ado, let's go ahead and get started. On your screen and my screen over here is Coverage for One. We are right now at demoagent.coverageforone. And the reason there's that little demo agent there is because every agent who partners with us in the individual markets, whether it is under 65 or Medicare, does get their own Coverage for One link that you can use and distribute to clients in order to help facilitate their shopping and enrollment experience. You may know Coverage for One from its earlier iterations where it was focused specifically on Blue Cross, specifically on under 65 business. But in the past few years, it has gotten quite a facelift, both on the body here, but also under the hood to really expand its capabilities and the ways it can support your business. So what we're going to do here today is take a tour through how you can use the platform to support your Medicare supplement and prescription drug plan business. We do have another demo scheduled tomorrow that focuses more specifically on MAPDs because the shopping experience is a little bit different for those type of products, as I'm sure you experienced agents know. So that's where we're going to spend our time here today. If you don't know what your login here is here, your personalized link, I do invite you to reach out to me, to Kevin, or to your account manager. They can help you get set up with Coverage for One and help you get set up with your credentials here. I'm going to go ahead and log in using some credentials I've already got saved to this Sandbox account and show you what your first steps are. When I log in, I am brought to my Coverage for One dashboard. Coverage for One dashboard has a lot of nice things for me to use here. Up top here, I've got a notification bar. So if there's anything we think that's important for you to see, especially maybe for your marketplace business or your Medicare business, we're going to highlight that for you right here. Recently in the under 65 market, there's lots of newer, they're not new anymore, but newer mandates around consent documentation and eligibility application forms and reviewing that. So you can find those forms right here in the system as well as a variety of information about the off-marketplace business you've submitted through the platform. But you're not here for off-marketplace business here today. You're here for Medicare. So all you need to do to go to your Medicare business is visit Medicare here over on the left-hand side and start quoting. That is going to bring you to our partner, SunFire. If you do partner with Action in the Medicare space, you automatically have SunFire credentials created for you. When you create your Coverage for One account, or when your account manager works with you to create that account, they are happy to get those credentials for you as well. But if you've already made your way here, you know where to go. Kevin and I can share a little bit about how to log in. Your default username and password, your username is always going to be the email address we have in file. In this case, it's my email address here at Action Benefits. And there is a default password formula, which Kevin is going to put in the chat for us very soon. So you can see what that looks like. And there it is. You can see what that looks like, and I'll play with that. It's a combination of your NPN and your initials that you can use to get into SunFire here. If I were to click login here, it would take me to the live environment where I'd be quoting and doing enrolling, and I don't want to do any of that just yet here in our practice environment. So I am going to come over to our training environment over here on this tab and pretend that I've logged in, and this is where the show is really going to start. I'm also going to make this a little bit bigger for you to see because I know SunFire in platform has a some smaller fonts that it uses. So I want to make sure you can see everything that we're working here on today. So once you get in the platform, you see that you're still in CoverageForOne with our partnership. You see a dashboard here with some quick links to things you'll commonly do to manage your Medicare business, searching contacts, quoting and enrolling, setting scopes, and you can view some reporting on your Medicare business that you submit through the platform. Where I want to start, though, is not through scopes, not through quoting, not through enrolling, but through a few things that can help you get your profile up and running so that you can use it and consumers can use the shopping experience here as well. So I'm going to come down to this lower left here, the agent profile. And it's going to give me some things I can work with here. So I see, for example, I can always change my username if I want to. I can update my password and generate some other reporting over here as well. This ready to sell report shows me which carriers I am ready to sell for, at least according to Action and SunFire's records. So that is good to know. You can update your information here. You always want your NPN to be current, so that way commissions get assigned to you for any business you write here in the platform. Also down here is your PURL or your personal URL. This link, if you do have customers that are ready to shop for Medicare or starting to experience their own, they can use this link to come right into a consumer-facing portal and begin that shopping experience. Kevin, I know you've talked to some agents about how they're using that personal URL. What have you heard from them so far?
Yeah, so I would recommend displaying your PURL on your website or any social media accounts that you currently have. If I were to visit your page and clicked on your PURL link without even speaking to you, I could quote and enroll myself, and you would get credit for that enrollment. There would be no need for a scope of appointment because we never even spoke in the first place. I just went to your website and used your link. And if you have any issues or need help with setting up your website or social media accounts, please contact anyone at Action Benefits, and we'd be more than happy to help you.
Yeah, great points, Kevin. A great way to get that out there and really facilitate that shopping and exploring experience. Even if your consumers don't enroll using that link, they're likely going to have some good questions to come straight to you with, right? You can pick up the process from whatever quoting they might have started for themselves as well. You also have an option for choosing where you're going to get notifications, whether they're email or text notifications. Always, I recommend that you at least do one of these. That way you can see whenever a beneficiary does something in the platform, and you can get some notifications here as well. Would always encourage that you put a primary number here as well. That primary number is what displays on your PURL. So if a consumer has questions, they know that they can call you, and don't stray off and talk to someone else when they have questions about what they're looking at. You can also always edit your signature. This signature is the electronic signature that gets appended to scopes of appointment and other documentation you might use related to Medicare. And I know we're talking about MedSupps here today, but you rarely ever talk about MedSupps without a PDP, which is why we're going to talk a little bit about scopes here today. That's as simple as drawing whatever you want your signature to be. I think this is the training account, so I'm going to scribble out training here and save those changes and be off to the races. So now I've got a signature, I've got my profile ready to go. I know where to copy my PURL from, and that's kind of the housekeeping stuff that we need to be aware of before we move into the platform. So I'm going to come back to this home screen. This is my dashboard, which is that screen we entered on a little bit ago. If I were to hover over these, I can see that I can view contacts, which is everyone, whether it's a prospect or someone that's in my book in the system here. I can start the quoting process. I can start a scope from this side and also access reporting. And there's always help features and notifications I can access down here as well. And again, because we rarely talk about MedSupps without PDPs, I want to show you what that scope process looks like, because there are a number of ways you can partner with the beneficiary to get that done. So I'm going to click here on Send a Scope. Clicking over here would do the same thing for me, but I like easiness. I like big, bold icons. Here's where we're going to go. Across the top of your screen, you see, or in the top right corner of your screen, you see some options for giving that scope to your beneficiary. You can email the scope directly from the platform. You can text the scope. You can complete the scope with them sitting right next to you, or if you already happen to have maybe a paper scope and you've uploaded it as a PDF, you can upload that scope and attach it to your client here as well. For easiness' sake, we're going to start with the text scope here. Though the process is very similar for any of these. And I, as the agent, have the option to pre-check all of these boxes if I so choose. Some agents, of course, want the beneficiary to fill out those boxes. Really a matter of how you want to do business. The system does let you do either of those. But whatever the case is, even if you have a pretty good idea, or the beneficiary has a pretty good idea, they want to talk about MedSupp, the more boxes you have checked, the better. The more boxes the beneficiary has checked, the better, because that really opens up the ways that your conversation is compliantly allowed to go. You'll complete some additional information here. So you'll start with the beneficiary's first name. It does need that from you. So we'll use, what month is it? February. And we'll call this our February sample, so that way it's easy for us to find later. You can also input the address. That is optional, or you can leave it for the beneficiary here. For this, I am going to say that it is a walk-in appointment, and that is important because of the 48-hour rule and the reappearance of that. Kevin, how would I handle this if it was not a walk-in, or what else could I do?
So when it comes to the 48-hour rule with the scope of appointment, if you meet a client and get a signed scope of appointment, you have to wait 48 hours until you can continue on with that appointment. However, if a client walks into your office and wants to discuss Medicare plans, the 48-hour rule does not apply since they actively address that they want to discuss Medicare. Keep in mind, it is the same if your client calls you and states that they want to talk about Medicare and enroll today. The 48-hour rule does not apply in that situation. However, if they call you to set up an appointment at a later date to discuss Medicare, you will need to honor that 48-hour rule.
And yeah, you're exactly right, Kevin. So the two exceptions to the 48-hour rule that came back are walk-ins and call-ins. So for easiness' sake here and being able to work through the whole process, I'm going to say that this is a walk-in appointment, but obviously, of course, you want to document these as appropriate. There is all of the Medicare definitions that your client would need to see here. So this is a fully compliant scope approved by CMS. All I would need to do then is get ready to have a phone number ready. I am going to put in a phone number here where I can access the text here. I will give you forewarning, because this is a training environment. Sometimes all the wires don't stay hooked up the same way they should. So before I click send here, I want to point out a few things to you. Up here is a personal code. That is your beneficiary's key to unlocking their scope of appointment. So when you text the scope to them, or before I text it to myself here in just a moment, I want to make sure I have that code on hand to give the beneficiary. So maybe I have them on the phone, or I email them this password, that personal code, so they can get in and unlock their scope and complete that scope as appropriate. In this case, it is 911916. I'm going to send that scope to that number, and it should go through. And in fact, it did go through and brought me back here to the dashboard. So I'm waiting on that text to come through here. And I am going to go ahead and complete the scope on my phone. And you're going to see some things change here in just a moment. It is waiting for my signature. And again, it has the personal code that it's waiting for here. So if I were on the phone with myself in this case, I would say that I need personal code 911916 to unlock that and continue. As a beneficiary, I can go ahead and then complete the scope and complete everything else I need to here and sign it. I should point out that every Medicare disclaimer that's relevant does show up on the scope here as well. Meaning that everything that SunFire knows you offer will appear in your plan counts and those sorts of things. So that is important to know here as well. I just clicked refresh. You can see now that the beneficiary has signed it, but it's not yet completed. So I can view the scope of appointment. I know it's incomplete. All I need to do though is the agent is click sign. And now it is ready for me to go. It attaches that signature that I made earlier in my profile. SunFire will retain the documents for 10 years for me, just to be compliant, or current year plus 10 years to be compliant with CMS rules. But if I want to be doubly sure, I can also generate a PDF here. It's going to download in it the way any other file downloads, and I can save that and keep that wherever else I keep my scopes. Kevin, anything else to mention about scopes before we go forward?
I just want to point out that SunFire will house your scopes for 10 years, so just keep that in mind.
Mm-hmm. Absolutely. So now we see this scope is complete. I can go ahead and have that appointment. I'm going to come back to my dashboard. And now what I've noticed here is different about my dashboard is I have February sample. This contact I just created shows up on my dashboard. So there's a few things I can do. I can just view that contact. I can start a quote. I can send them my personal URL via email or text, so they can start their shopping or quoting experience here. But you want to see the kind of the full shopping experience. So I'm going to start a quote for this person here. If I want to, I can also go back and view the scope I just sent them, but no need to because we just did that. So I'm going to start the quote here. And what CoverageForOne does super well is helps you really identify, it takes you through that needs assessment for your consumer and figures out some things that you need to know and they need to know in order to choose a plan that is a great fit for them. Right here up front, you should know that you can start, if you do have their zip code, Medicare number, and date of birth, as I'm going to pop in a dummy MBI here as I keep talking. So no fear that I'm giving things away here. And I'm going to pop in a dummy date of birth here. What happens is the system is connected with CMS on the back end. So as soon as I click lookup, it's going to see whether this beneficiary exists. It's going to tell me what their Part A and or B effective dates were, and if they are eligible for any low income subsidy, which is important for your Part D plans. It will tell me that here as well. I also have the option of going right to plans if I'm not ready to use discovery here. Maybe I just want to find out what's in the zip code. But generally speaking, if you want to find the best fit, always recommend that customer lookup here because it's going to help you develop a good profile for your customer. So if I click lookup, I'm going to get an error message here only because I'm in the sandbox environment and because that it is not actively hooked up to CMS. So that's why that error message popped here for us. It's going to tell us that I have a forbidden error here, but that's okay. I can go forward. Hopefully you will have an accurate Medicare number when you go forward with your clients. It is a pretty neat tool. From here, I then have the option of choosing what plans I want to discuss with the customer. And I'm only going to highlight MAPD so I can show you that it only shows you the questions you need to answer to really serve that client and what they're interested in. It is pretty respectful of your time and of your client's time going forward. So if I have MAPD highlighted, it will ask about PCPs and other doctors. But if I only highlight if I unhighlight MAPDs and only highlight PDs, it's going to go straight to the drug questions for me to help really build that list. Because I'm interested in prescription drug plans and Medicare supplements, it's also going to give me some underwriting questions that I can start with here as well to help me figure out what those rates might look like for that MedSupp. It's also going to ask whether I'm currently enrolled. Because it couldn't find the beneficiary up here, it doesn't answer that question for me. So right now I'm going to say yes, and actually I'm going to say no because they're not in a Medicare Advantage or drug plan, but they are on original Medicare. So say, for example, I am looking for a March 1st effective date. The date of birth for this client was 10/14/1947. So they had an effective date quite a bit ago. If I had a guaranteed issue situation, I could check that here. It also asks about tobacco. Carriers do have more underwriting questions, as you well know, but those will pop up a little later in the process. This is just to kind of get us close to what those rates might be. Because this person was effective in 2012, 11 years ago, they're probably not GI unless maybe their plan closed. So let's say maybe their plan did close, and we can check that here. There's also the tobacco question. We're going to say they're a non-smoker for now. Here is the really exciting part, though, that makes your life so much easier, especially when you are looking at drug plans across carriers. As we put in medications here, and if you go on to the next screen, it's going to check every carrier formulary that you have in SunFire and figure out whether and how all those drugs are covered. So let's put in a few drugs here and make it a little difficult here. So let's say we are on dealing with an asthmatic, albuterol sulfate. You're going to see common generic or brand names for that. You're also going to see dosages. You can pick refill frequency here as well. So you get one of these every 3 months and save that medication. Maybe they're also on a control inhaler, but it's not just any control inhaler. We're going to pick one. So the typical dose gets highlighted here, but maybe they have more severe asthma that they are treating here. So maybe they have a higher dose of that, and they do get that filled every 90 days here as well. So I can save that medication. And maybe our client here is also fighting depression or whatever the case might be, or they're living with depression and trying to work their way through that. So they've got bupropion HCl, 100 milligrams. They refill that every month and get 30 pills per fill. I can also ask whether or not they have a pharmacy they use to fill prescriptions. I can say yes, no, or mail order. If I said mail order, that's going to get the pricing direct from whatever pharmacy the mail carrier has. But if I do say yes here, and here's where it gets cool. Maybe I shop for CVS. It's going to show me prices for all those drugs at CVS with each carrier, and also going to show me some ways I can perhaps save the beneficiary money if they're willing to move their prescriptions for that particular plan. There's also the LIS question here, again, because I couldn't pull it directly from CMS. It doesn't give me a LIS here. For brevity's sake, we're going to say no, this person does not receive extra help. But again, if we do have a valid MBI and Medicaid number, this question will automatically populate and show you their LIS level. We're going to go ahead and view all plans then and see where the magic happens here. So starting across the top, I want to show you a few things before we dig into all this stuff. You see that we offer 7 plans here in that zip code. I can see that the client is currently enrolled in a non-MAPD plan. I can change their pharmacy and medication simply by clicking on those here as well. On the left, I can filter by the plan type I want to look at. Right now, again, I'm looking at just Part D plans for this person. I can filter by company, by premium level, and whether or not the plan has a deductible. Here in list view, there's a few things I can take a look at. So I see the drug deductible, the pharmacy, and whether it's standard or preferred. It does also tell me that I can save $156 per year by changing to a mail order pharmacy. So that is the pharmacy that Blue Cross uses, OptumRx, for their mail order prescriptions, or I can choose another pharmacy nearby and get pricing on that. So maybe they don't want mail order. Maybe they do love the experience of getting out of the house and going to the local Walgreens. They can do that as well and see how pricing changes. So now I know I'm preferred. I know my drug cost went down. It was $212 or so annually. Now it's down to $120. I see that 3 of 3 drugs are covered. Still, there's still savings out there to be had with mail order as well. I can look at my monthly plan premium and estimated annual cost, and really start making some decisions or talking to my beneficiary and presenting these plans to them about that. If I do want more information, I also can go to the details here On the details, I see all the prescription drug benefits. I see what it looks like for a 30, 60, or 90-day supply. So how are generics covered at 90 days? I can go down all the way to 4 or 5, tiers 4 and 5. I can see whether and how things are covered in the gap and what is going on in the catastrophic phase. Also have access to summary of benefits, EOCs, star ratings, the pre-enrollment checklist down here as well. If I come back to my plans, there is another way I can give a little more detail on these plans to help compare them. The X-ray view shows you a little more detail about the plan right away. Again, you can go across these tabs here to see your benefits and drug cost details. It does give you some sorting options. So based on the information it knows about the beneficiary so far, it thinks that Prescription Blue Premium is the best fitting plan based on what we've said so far. Shows you how drugs are covered, what their costs might be annually, and works from there. If we get over to drug cost details, and especially if we had some more expensive drugs, it's going to show us what their estimated cost per month might be here as well. So taking a look, I know that they're in January, they're in an initial coverage fill. There's no copay for that inhaler, which is good to know. But they're going to be paying $20 a month for that first fill of that bupropion and albuterol sulfate. But as they go on, we can start to talk with the beneficiary and build out exactly what they'll be paying year over year or month over month for their medicine, which is really helpful for your seniors who are really trying to budget what that might look like going forward. Some of you might also want to know how we can compare plans with each other. You can do that from here. You can also do that from the list view if I want to compare and generate a few plans here. So if I want to put this Prescription Blue Premium, this Medicare RX Preferred, and this Humana plan all side by side, I can generate a comparison right here, puts them side by side, shows me that benefit information. And when the consumer makes a choice here, we can go ahead and start enrollments. And again, I have all that drug cost detail information here for me as well. Should also mention that I can email this directly to the consumer simply by putting their email in. So they're going to get this side-by-side comparison of these 3 plans. It's going to give them everything that we just gave them so they can see it all side by side. The same thing, though, they're going to need their date of birth and a PIN, this PIN here, just like they needed with the scope to be able to view that personalized recommendation you have for them. So all in all, pretty powerful stuff to be able to deliver that multi-carrier quote right to their inbox as they work. We're going to go ahead then and look at what enrollment does here on this side. The enrollment looks like probably every other PDP application you've ever done. We're going to make sure that they understand the benefits. So we're going to go ahead and review those benefits and check them off as we do so in the conversation. So reviewing that premium, deductible, your copay tiers. We're going to look at any other benefits in their summary of benefits. We're going to make sure that we're compliant by reviewing the CMS plan rating flyer here as well. And again, showing them and giving them access to the summary of benefits as part of that enrollment process. So it's really makes it impossible not to have a compliant sale as long as you're following through the boxes here. Consumers going to give their consent whether or not they do or do not understand the benefits in this plan. We're going to assume we did our jobs and say, yes, they do, and move forward in the enrollment process. You can toggle whether the applicant or POA is completing the application. Pardon me, first name and such carries over here, and they have a birth date of 1947. We'll choose their gender. Phone number that we put in earlier for the scope carries over here. We can put in an email address here as well. We'll put in a residential address for them here. It's actually the Action Benefits Office, but don't tell the training environment that. And the app looks again like a lot of applications you've probably already done. So we can choose whether race and specify race and ethnicity. We're going to choose language and accessibility, and maybe they want large print to help them read those materials at home. I'll put in that MBI here one more time. It's going to give me the option. It knows that I'm in an SE-Pay here, right? Because I'm not doing AEP. So let's say, for example, for giggles, they moved to a new service area here. and that SEP happened on 02/4/1 2024. And we can keep going from there. Proposed effective date, it's going to ask us about some coordination benefits. Will you have any other drug coverage? Not in this case. Will me or my spouse work? Not in this case. We're going to go on and click next. We're going to confirm that we've talked about the benefits to the beneficiary satisfaction and say yes, that they understand their premium. I do have the option to start and log payment information here as well. So if I want to just mark that it is going to be withheld from their Social Security check, I do have to read that disclaimer to them, and then I'm off to click next. I can then review the entire application. I've got to read that whole disclaimer. It's all scripted for you and does change based on carrier. So if you were not selling a blue plan, you were selling a Humana plan, it would say that here as well. So makes it foolproof here when you're having those enrollment calls. They're going to give you acknowledgement, and then you have an option of how you want to get that signature done. So whether that signature is a text message, whether that's an email, that works as before. They can do an e-signature, or if you are happen to be working on a tablet, they can just use their finger and put their signature right here for you here as well. Once they save that signature, we can submit that app, and it is going to go off to the carrier. Yeah, Frederick, I see your question here. For everyone, Frederick's question is, while this is working, only carriers you're appointed with appear in the quote. To be even more specific, only carriers you have with action will appear in the quote. So if you maybe have Humana or something with another FMO, that won't show up in your instance of SunFire here. That would show up in whatever that FMO offers for you. But if you have Medicare business with action, it shows up here in your profile so you can quote it, and your beneficiaries can quote it here as well. Let me know if that helps or hurts, Frederick. But from here, I've got the application done. I can go ahead and keep that for my review here as well. And I can close that. But wait, you say, there's more. We just talked about PDPs in the last few minutes. Let's take a look at MedSupps here with February sample. So I would want to view that quote again. And it's loading them up. We already did that PDP, and we already know they're enrolled. I want to pop over and take a look at Medicare supplements. Now, I do have some options here. Again, in the training environment, it shows me way more carriers than we have, or way more carriers than I'm appointed with. So I'll filter those down. But I can filter by what types of plans I want to see. So plan A through N in the high deductible versions. I can narrow down carriers here as well. So maybe I only want to see Blue Cross, Humana, Priority, UHC, and Wellaby. So most of Action's portfolio that I can present to my clients here. I can also filter by premium if I want to as well. And let's say that as this person is looking, maybe we're looking just at Plan Gs for this person here. I do have some options. I can change this profile, right? It tells me right now that I'm looking at a 76-year-old female who's not a tobacco user with no discounts and 3 meds. If, for example, we know they're eligible for a discount based on those rules, generally they have someone else living with them that is also on a plan. I can apply that household discount right away. It does mess with my filters a bit, but I want to be purpose about showing you that so you don't get surprised about it later. So I'll go ahead and highlight Humana, Priority, Wellaby as well. So UHC and Wellaby, so we can put them all side by side. So for this particular person with their household discount, right? If Humana offers that 12% household discount, brings their monthly premium down to $147.36 for that G. If I were looking at Priority with their 12% discount, $166.72, Wellaby $171.92, Blue Cross Blue Shield $183.69. All things being equal, your beneficiary probably likes saving premium dollars here. In this case, you also see that with the national carriers like Humana and United Healthcare that we partner with, you can click enroll, and that's going to take them directly, or take you rather directly to that carrier's enrollment tool. The reason why is because every carrier has different MedSup underwriting guidelines and what is a knockout question, what isn't a knockout question, and CoverageForOne isn't smart enough yet to handle all those. So if they were interested in this Priority Health, this Wellaby, this Blue Cross Blue Shield of Michigan, you could go over to your carrier portal as appropriate and begin that MedSup enrollment that way. For that, that the platform isn't quite there yet, but the platform is really good at showing you rates. And here, especially maybe for this person who doesn't have much of an income, that Humana Plan G, age-attained rated with a 12% discount, it's probably the better rate available to my client. I know I've got dental vision buy-ups in my pocket. So that is MedSup shopping in a nutshell. It is not too hard, but the great benefit is, again, you can put all those carrier rates side by side and really talk with your client about what's the better fit for them and their budget, especially if they're looking at Gs that might be a little bit pricier for them going forward, and especially as they are either move up in age or whether they look at community rated plans and see how those shake out for them. Kevin, anything to add about either PDP applications or the MedSup process before we turn it over to our agents for any questions they have?
No, you did a great job covering that, but I just want to say that if anybody on this webinar is interested in adding more carriers, please contact Action Benefits and we'd be happy to help you out.
Yeah, excellent point, right? If your Blue Cross looks over here looks a little lonely, you want a few more options to look at, you want some of those other rates to look at, your account management team is happy to help you start that process and shepherd that to its end. All of that said, ladies and gentlemen, we're booked for 45 minutes. We are here about 37 minutes into the presentation here today, which means we got some time for any questions that you might have here before you head out. Happy to take any questions you have, but also knowing that we all love to have a little bit of time back in our day. I'm not going to begrudge you if you do take off now. You can maybe spend a few more minutes with your Valentine here today. Want to thank you all for your time and attention here today. Please reach out to me or your individual team with any questions or help you need. I'm going to stop the recording here, but we'll stick around for any other questions you might have about either the platform or anything else that's on your mind.